Hi, everyone. For my targeted literature review, I have chosen to discuss the increased level of stress on caregivers of people living with Alzheimer's disease and other dementias during the COVID-19 pandemic. So let's go ahead and get started. So, as we know, in late 2019, the world quickly began to change as the severe acute respiratory syndrome coronavirus 2 was detected as the causative agent of COVID 19, which is a respiratory illness that was first discovered in China and then quickly spread into Europe and the rest of the world. Much research was conducted during the early stages of the pandemic, and it was determined that individuals with premorbid conditions and/or older age were at risk for COVID-19 mortality. COVID-19 was soon coined the geriatric emergency of 2020. Among older individuals, those with Alzheimer's disease, further known as AD throughout this presentation, and other dementias are more likely to be most vulnerable given the nature of their disease, as well as the indirect effect that the pandemic has on their social and medical support. Individuals with moderate and severe AD are entirely dependent on caregivers. And we know that COVID-19 is highly infectious and its management requires isolation and quarantine. And the need for caregivers for AD management conflicts with that of COVID-19. Providing care for older adults, in particular those with dementia, poses an already stressful and challenging task that may have a negative impact on psychological well-being. But when we couple in the pandemic, those stress levels continue to rise even further. Caregiver burnout and strain has been widely discussed, but as COVID continues, those caregivers are becoming increasingly depressed and anxiety-ridden, indicating that lockdowns have induced a significant change in their lifestyle. Caregiver burden can be defined as the strain or load borne by a person who cares for a chronically ill, disabled, or elderly family member. Caregiver burden can have many different faces, including but not limited to physical problems, psychological or emotional problems, social problems, and even financial problems. Caregiver burden often surrounds the family members, including the principal caregiver who is caring for the individual with AD or other dementias. The type of burden is also often multidimensional, being objective and subjective. As we continue throughout the presentation, we will unravel how caregiver burden has drastically increased during the COVID-19 pandemic. Studies show that neuropsychiatric symptoms are most predictive of caregiver burden and depression. Common effects that typically drive this are disruptive behaviors followed by delusions and mood disturbances presented by the patient. We typically see disruptive behaviors in individuals with dementia due to the adverse impact on the emotional connection between the care recipient and the caregiver, as well as difficulties in other domains such as activities of daily living. Individuals that have aggressive forms of dementia also exhibit variant behaviors, often inciting their insensitivity to others' feelings. This alone induces stress for the caregiver. A meta-analysis found dementia family caregivers to be significantly more stressed than non-dementia caregivers and to suffer more serious depressive symptoms and physical problems. Additionally, these individuals expressed elevated levels of depression and anxiety due to other symptoms displayed by care recipients, such as visual hallucinations and delusions. In fact, studies show that more than 80% of Alzheimer's disease caregivers state that they frequently experience high levels of stress, and almost half report that they suffer from depression. Therefore, it's no shock that because of this, poor outcomes for dementia patients, such as substandard quality of life and early nursing home placement, are both inevitable. Caregivers who are heavily burdened may unfortunately opt for institutionalization of the care recipient as a role exit. However, given the coronavirus pandemic, quarantines and lockdowns have only further progressed the burden that caregivers feel. Many psychological implications are associated with the introduction of the restrictions applied by the government during the pandemic, such as social distancing and limitations in individual mobility and social activities. These types of restrictions may have negative consequences on the possibility of being supported by others, as well as low social support being associated with higher depression in caregivers. If families opt for institutionalization of their loved ones suffering from AD or dementia, they must deal with the fact that they may not be able to come into close contact with the patient because most care facilities have their own restrictions. This makes it very difficult for the caregiver to offer effective supporting measurements. Additionally, if the family opts for the care recipient to remain in the home to receive care, other challenges arise such as limited participation in activities for both the patient and the caregiver due to COVID restrictions. The challenges of telehealth consultations to obtain more details on the patient's condition, as well as the lack of knowledge about dementia and/or healthcare alone. Because of this, caregivers often risk struggling with negative emotions such as self-criticism and shame. During the COVID-19 crisis, it has become extremely challenging for individuals with dementia and their caregivers to cope as a direct result of loneliness that has been established from confinement and isolation. Many analyses have been conducted to measure the level of caregiver burden during the pandemic. According to one analysis of 84 polled participants, nearly 60% of caregivers completely stopped working, and many switched to smart working or reduced their working time, while roughly 20% of caregivers continued to work in the same modality as before. In addition, the polled caregivers also indicated an increase in PPE protection wearing and an increased frequency in house cleaning. More than half engaged in social distancing. These statistics are interesting to note because not only are these extra safety precautions and professional workloads an added stressor for the caregiver, but the concern for getting the virus themselves is also a contributing factor to increased stress and worry. Of the caregiver sample that was obtained for this analysis, 75% indicated that they felt the COVID-19 pandemic was a threat for their own health as well. In an additional analysis, it was observed that family caregivers reported that after a quarantine period of approximately 47 days, dementia patients showed a worsening in cognitive symptoms, behavioral symptoms, the onset of new behavioral symptoms, and an increase in motor symptoms. Social isolation and physical restraint has not only caused a worsening in the aforementioned areas, but has surely dramatically increased caregiver stress as well as burden. In fact, according to a survey response of 5,321 caregivers of patients with AD and other dementias, approximately half of the caregivers reported that quarantine induced a significant change in their lifestyle, with 30.3% complaining of a reduction in time devoted to their own activities and 15.5% reporting an increase in intrafamilial psychological conflicts. Caregivers reported a significant increase in anxiety, 45.9%, depression, 18.6%, irritability, 26.2%, and distress, 28.9%. If you direct your attention to this spider plot here, you will notice the increase of symptoms in AD patients. Changes in the caregiver's lifestyle can also occur if either the caregiver or the patient gets sick with COVID. It's important to note that both are likely to have comorbid conditions that could make catching the disease easier and more life-threatening. Diabetes has been shown to be one of the most common comorbidities in COVID-19 patients. Not only is this a risk for individuals without AD or dementia, but it's an even greater risk for patients with AD, as diabetes is one of several comorbidities that are found in AD. Overall, clinical studies determined that AD comorbidities, especially diabetes, are associated with poor outcomes of COVID. This places an extreme burden on caregivers. With caregivers having to look after a loved one who not only has AD, but is also fighting COVID with comorbidities, it's clear that there are greater odds of high emotional difficulties and low gains from caregiving. Unfortunately, if caregivers become ill with the coronavirus disease themselves, they will need to quarantine and spend time away from the patient suffering from AD in order to prevent spreading infection. This leaves the patient to be cared for by an inexperienced family member or a friend, or being placed in a care facility, which may have their own coronavirus precautions that could prevent visitors from entering the facility. This can leave the patient feeling lonely and being without their usual caretaker, and the inability to spend quality time with family and friends due to the facility's stringent restrictions, also causing stress for the caretaker. Caregiver wellness is a top priority, especially during this time. By providing effective interventions to reduce caregiver burden, quality care can be provided by the caregiver as they are being supported in their emotional and physical health. In order to preserve and protect caregiver wellness, patients should be enabled to participate in clinical trials to ensure access to potential treatments before they are widely available, in addition to the expert medical care they can receive that is often free of cost. Likewise, caregivers should take the time to care for themselves by eating healthy foods, taking breaks throughout the day, getting exercise as often as they can, and continuing to see their doctor on a regular basis. Luckily, now that vaccines are more widely available, there will be some light at the end of the tunnel for caregivers as they get back to normal living, joining caregiver support groups, spending time with friends, and keeping up with hobbies and interests. Thank you for taking the time to listen to my presentation. I hope you all were able to learn something new. If you have any questions, please feel free to drop them below in the comments box, and I'll do the best I can to answer them.